Welcome back. In this session, we are going to discuss another homeopathic remedy which has an excellent action on the respiratory complaints. So, the remedy is Sambucus nigra. You can see in the picture here, it is Sambucus nigra. The common name of Sambucus nigra is elder. It is proved by Dr. Hahnemann and belongs to the family Caprifoliaceae. So guys, you can see Sambucus nigra is another excellent remedy from the vegetable kingdom which is suitable for the respiratory troubles. So the mother tincture is prepared from the leaves and the flowers. The parts used are the leaves and the flowers, out of which we are going to prepare the mother tincture. The freshly expressed juice contains the vibernic acid and vibriani. These will produce an unpleasant odor. These trees of Sambucus nigra are usually found in the Central Europe, where we use the bark as well as the leaves for making ointments for the external applications. The flower was used in the previous times for fermentation and for preparing the medicinal tea. It was proved by Dr. Hahnemann and it was introduced in our Materia Medica Pura. The miasm is Sora. The diathesis is scrofular and thermally the patient is very chilly. Let us move further to the constitution. It is adapted to persons who are formally robust. You can see the patient is formally very robust and fleshy, but suddenly he becomes emaciated. The robust and fleshy person who was formerly very fleshy, later he becomes emaciated and it occurs suddenly. It is suited to the diathesis of scrofular. Scrofular children where the air passages are affected. You see, scrofulous children, especially when the affection of the air passages is found. Let's move on to the pathogenesis of this drug. So we know it is a chilly patient, and now we see the pathogenesis. The Sambucus acts on the mucous membrane of the respiratory tract. It acts both on the upper as well as the lower respiratory tract. Acting on the respiratory tract, Sambucus produces spasms, which results in dyspnea. There is coryza and cough. Spasms, dyspnea, coryza, and cough. The nose block and asthma is observed. Acting on the renal system, it produces inflammation. Acting on the skin, it causes burning and eruptions. So I guess the pathogenesis is clear. So we saw acting on the upper and lower respiratory tracts, it produces spasms, dyspnea, coryza, and cough. We see acting on the renal system, inflammation. On the skin, there is burning and eruptions. Moving further to the guiding symptoms, you can see the picture here. The patient is having profuse sweat all over the body. The profuse sweat is seen all over the body during the waking hours. The patient sleeps or when he closes the eyes, the sweat disappears. We see when the patient is sleeping, what happens? The sweat will disappear. Clear, guys? Profuse sweat, especially when the waking hours, when the patient is up during the waking hours, there is sweat. But once the patient goes to bed, once he sleeps or he closes his eyes, the sweat will disappear. When he is again up in the morning during the waking hours, there is profuse sweat all over his body. Night again, the sweat will disappear. The other remedies where there is sweat when the patient is going to bed is China, conium, tuja, cactus. In these remedy, tuja, cactus, we see the sweat especially at night. When the patient goes to bed, there is sweat. in cases of thuja, cactus, conium, china. See, cactus, conium, china. C. You can remember like this. Sweat when the patient goes to bed is cactus, conium, and china. When the patient has a profuse sweat during waking hours is our remedy, which is Sambucus nigra. Okay. Next, we move further. The patient has edematous swelling in various parts of the body, especially in the leg, in the step and feet. You can see the edematous swelling in the body. We saw this profuse sweat all over the body during waking hours. On sleep or closing eyes, the sweat disappears. The edematous swelling is felt on the various parts of the body, especially on the legs. Next, we see the dry coryza of the infants. The nose is dry, completely stopped up. You can see the nose of the child, it is dry and it is completely stopped up, which is preventing the breathing when the patient is nursing. Okay, when nursing, it prevents the breathing. Next, there is severe suffocative attacks of dyspnea. We see the patient has very severe suffocative attack of dyspnea, especially after the midnight. The patient will wake up suddenly and sit up in the bed. We see the patient is waking up suddenly from the sleep and he will sit up in the bed and start gasping for the breath. What happens? The patient has suffocative attack of dyspnea after midnight. He cannot inspire well. The patient, he cannot inspire well, but he can inspire well but cannot expire. See, we have in medorinum, the patient cannot inspire, whereas here in Sambucus, the patient can inspire, but there is some difficulty in expiration. When he is expiring, he is experiencing the difficulty. And also the face will become cyanosed, the lips will turn blue, face is livid in cases of Sambucus. So guys, what did we see the guiding symptoms? We have dry coryza of infants, the dry coryza of infants following the suffocative attack of dyspnea after midnight. Moving further, we have the ailments, that is mental emotions, especially the fright. Very important. All the ailments from begin in Sambucus because of a fright. We see after fright, the patient started with the involuntary movements, jerking of the hand. So we see the ailments from especially the fright which is resulting in the profuse urination. The only remedy which is available in our repertory is this profuse urination after fright is Sambucus. Remember the ailments from fright. After an attack of fright, the patient started with the profuse urination and the involuntary movement of the hand and trembling. Patient was very normal. After a sudden fright, the involuntary movement of the hand, it started. The only remedy which is mentioned is Sambucus, and also the trembling which started after the episode of fright. And choking, fright resulting in choking, fright resulting in wheezing, the respiration becomes difficult, and suffocated feeling after an episode of fright, the patient started with suffocative feeling. Then we see the violent mental emotions, then anxiety, grief, anxiety resulting in sleeplessness, and also the excessive sexual indulgence also resulting in sleeplessness. Okay, violent mental emotions, sexual indulgence, grief, anxiety results in sleeplessness. Moving further to the mental symptoms. The patient sees images when shutting the eyes. There is constant fretfulness. They get frightened very easily. They get startled and frightened very easily. And this fright, an episode of fright, is followed by the suffocative attacks. You can see the fright is followed by suffocative attacks. The dry coryza precedes the fever paroxysms. We see in the respiratory complaints, we have dry coryza which is preceding the fever paroxysms. We know acting on the respiratory system, it acts especially on the mucous membrane of the respiratory organs and sets up a catarrhal affection of the air passages. We saw this in the sphere of action, acting on the mucous membrane of the respiratory tract. What does Sambucus do? It produces the catarrhal affections of air passages. So, main the sphere of action is very important in every remedy. The pathogenesis. What does Sambucus do? Sambucus acts on the respiratory system specifically on the mucous membrane, producing catarrhal affections of air passages. There is dry coryza and suffocative attacks after an episode of fright. We see the dry coryza of infants. We can see the dry coryza of infants. The nose is completely stopped up. It is dry, which is preventing the breathing of the infants during nursing. Since the nose is completely dry and stopped up, and they cannot breathe from the mouth during nursing, so this leads to the suffocative feeling. Okay. Dry coryza is preceding the fever paroxysms. Before the fever paroxysms set in, there is dry coryza. Patient can inspire well but cannot expire. So tell me the remedy. Other remedy, we have medorinum. The patient here in Sambucus cannot expire, but he is able to inspire well. Regular inspiration, but the expiration is sighing. He's sighing during expiration. The suffocative attacks, we see the suffocative attacks of dyspnea, they are coming especially at the midnight. So the patient gets up suddenly, sits up in the bed and starts gasping for the breath. He becomes sad-nosed, blue, and the face will become livid. So all of these points we've seen in the guiding symptoms, which helps us to go through particulars very smoothly. The attack will pass off after some time, but again it will return for a short while. The attack, the suffocative attack, for some time it passes away, it stops, it disappears, it takes a pause, but again the suffocative attack will return for a short while. Patient can inspire well but cannot expire. Very important thing in Sambucus. The patient says that, doctor, I'm able to inspire, but the expiration is very difficult. And when you observe the patient, he will be inspiring well, but his expiration will be sighing. Regular inspiration but sighing, expiration. Attack in the last stages of croup. We have attacks in the last stages of croup. Acting on the larynx, it produces hoarseness and tenacious mucus in the larynx. Let us look into the cough of Sambucus nigra. The cough is suffocative, it is hollow, deep, dry, preceding the fever paroxysms. The cough is preceding the fever paroxysms. Prior to the fever paroxysms, we have cough. How is the character of cough? It is a deep cough, hollow, dry cough. Okay, it's dry. There is spasms of chest, bronchi, mucus and expectoration. In the bronchi, there is secretion of mucus and the expectoration is quite difficult. Moving further to the fever of Sambucus nigra. During fever, we see there is a dry heat when the patient sleeps, or on falling asleep, the patient has a sensation of a dry heat. The patient dreads uncovering and wants to cover up completely. He doesn't want to uncover. You can see in the picture here, the patient has a dread to uncover. He wants to cover up. He wants to cover up completely, and there is no thirst during the heat or sweat stage. During the heat stage or the sweat stage, the patient has no thirst. Fever is occurring without any thirst during the heat or sweat stage. It is preceded by, the fever paroxysms are preceded by dry cough. There is edematous swelling of all the parts of the body, especially the legs. So guys, is the fever clear? Fever What is the heat stage? There is a dry heat stage. The patient sleeps, and on falling asleep, there is a heat stage. And during the sweat stage or the heat stage, the patient has no thirst and he dreads the uncovering. He wants to keep himself completely covered. Okay. So we see further the child of Sambucus Nigra, they have respiratory complaints belonging to the scrofulous diatheses. So the glandular affections we can observe in them: dry coryza, nose block, sniffles of infants or the snuffles, or the noisy breathing in the infants. The nose is dry and obstructed. When nursing, the child must let go of the nipple because the nose is blocked and the baby cannot breathe. The child awakens suddenly, nearly suffocating. So he sits up in the bed, he turns blue, and he can inspire but cannot expire. It is also indicated in Miller's asthma. And you can see the other remedy is mephitis. Okay. Moving further to the urinary complaints. Should I just revise the child symptoms? I guess I was a little fast. So guys, we see in the child respiratory complaints, dry coryza, nose blocks, snuffles of infants. New thing which we saw is the snuffles, the noisy breathing of infants, nose is dry and obstructed. We know the baby cannot nurse well. It is because the nose is all stopped up, and so he withdraws the nipple. He withdraws his mouth, he lets go of the nipple because the nose is blocked and the baby is not able to breathe. So he wakes up suddenly, and the child, this is the infant, is not able to nurse. Then we come to the child, he wakes up, he sits in the bed, he becomes blue, he turns blue, cannot expire. We have mephitis, where the child wakes up suddenly, nearly suffocating, and he sits up in the bed and he's turned blue because of the suffocation. It is indicated in Miller's asthma as well. Moving further to the urinary symptoms, there is profuse urine with a dry heat of the skin. During fever, we saw the dry heat. Even in the urination, there is profuse urination. We saw the only remedy after an episode of fright, if the patient starts with profuse urination, only remedy in our repertory is Sambucus Nigra. There is frequent micturition with a scanty urine, acute nephritis. So the patient has frequent micturations with a scanty urine. The micturation is very frequent, but the quantity of the urine passed is very scanty. Acute nephritis, dropsical symptoms. We see because of the nephritis, there is dropsical symptoms. We saw the like the feet, the patient has an edematous swelling. The various parts of the body, especially in the legs, we see there was an edematous swelling. We saw it in the guiding symptoms. So the dropsical symptoms will be present, and because of the nephritis and vomiting. Profuse urination after fright. Then we see the extremities, the hands will turn blue, edematous swelling in the legs, in steps and feet. The feet are icy cold, and the debilitating night sweat is seen in these patients. We saw the first symptom. We began our session with the profuse sweat all over the body during the waking hours. So when the patient sleeps or closes the eyes, the sweat disappears. But in the extremities, we see the debilitating night sweats. Moving further to the skin, dry heat of the skin during sleep. When the patient sleeps, there is a dry heat, bloated, swollen, general dropsy. So we see the entire body being bloated, swollen, general dropsical condition, and there is profuse sweat during the waking hours, and there is no sweat, okay, when the patient sleeps. Moving further to the modalities, so can you guess the modalities? The complaints are aggravated during rest, after eating the fruits, uncovering, and we also have the main modalities like sleep after midnight, especially 2 to 3 a.m., uncovering, eating fruits, cold drinks. So the main thing is sleep, night, midnight, 2 to 3 a.m., and uncovering. Amelioration when the patient sits up in the bed and motion, pressure, these are the symptoms these are the conditions which will ameliorate. So sitting up in the bed and motion, most of the pains will occur during the rest and they will disappear when the patient is in motion. Okay, and pressure. So with this we come to an end of Sambucus Nigra. I hope the session was productive, and if you have any doubts, put them down in the comment section, and if you like the video, hit the like button and please subscribe.